Well, as you know, we've always been concerned about the slippery slope of euthanasia and how the demand for euthanasia will expand the calls for certain conditions. And the latest one is that euthanasia should be available for anorexia. Let's check it out. So Net, the blog site, had a article that I read where a leading eating disorder specialist has proposed that patients with anorexia nervosa should be allowed access to assisted suicide. Dr. Jennifer Godiani is a Denver-based physician, and she contends in the Journal of Eating Disorders that, let me show you the slide, patients with terminal anorexia nervosa who are severely physiological compromised and whose end-of-life suffering results from both psychological and physical pain should be afforded access to medical aid in dying, in other words, assisted suicide, in locations where such assistance has been legalized, just like other patients with terminal conditions. Now, anorexia nervosa is extremely dangerous. It has the second highest mortality rate of any psychiatric disorder after opioid use. But normally it is treatable. But Dr. Gardiani believes that there are patients who are suffering from a heightened form of the disorder, which she calls severe and enduring anorexia nervosa. And so in her article, she narrates the stories of 3 of her patients who gave up fighting their disease and chose to die. Although ironically, of the 3 examples, which are all heartbreaking, one refused treatment and didn't actually ask for assisted dying, and another died in a hospice without assisted dying. But Dr. Godiani is pleading for her colleagues to acknowledge that assisted suicide is appropriate end-of-life care for patients who suffer from severe anorexia nervosa. But an Australian psychiatrist, John Buchanan, told Net that anorexia is a very complex disease. Medication is only one piece of the puzzle, and sufferers need psychotherapy and behaviour modification therapy, and they may take years to succeed. And he says the distress that anyone experiences with an illness is proportional to the quality and extent of the treatment and management. There's a lot of poor quality psychiatric treatment being done. So therapy may be needed as well for families to help them to be resolute in supporting their loved one. And this adds an extra layer of complexity to the treatment. And as Dr. Buchanan points out, and note the relevance of this statement as it also applies to euthanasia. He says the psychological reality is that family members often have very ambivalent feelings about a person who is seriously ill. The notion that all families are caring and benign is regrettably false. Many would prefer the ill person got on with it. So what if the anorexia patient fails to recover because their family is simply not committed to the necessary level of care? In such a case, recourse to euthanasia would be putting the patient out of the family's misery. And this is the slippery slope of euthanasia that we will be watching carefully in New Zealand. Now, the good news is that there is help in New Zealand for anorexia through the Eating Disorders Association of New Zealand. And they refer to FEAST, which is a global community of parents and those who support families, parents and families affected by eating disorders. Have a watch of their key principles.
Number 1. Eating disorders are treatable. Eating disorders are biologically based mental illnesses and fully treatable with a combination of nutritional, medical, and therapeutic supports. Number 2. Parents are not the cause. Parents do not cause eating disorders and patients do not choose them. Number 3. Caregivers are powerful. Parents and caregivers can be a powerful support for a loved one's recovery from an eating disorder. Number 4. Blame causes harm. Blaming and marginalizing parents in the eating disorder treatment process causes harm and further suffering. Number 5. Evidence-based approach. Patients should receive evidence-based treatment when available. Number 6. Appropriate treatment. Families should be supported in seeking the most appropriate treatment in the least restrictive environment possible. Number 7. Nutritional rehabilitation. Food is medicine. All treatment should include urgent and ongoing nutritional rehabilitation. Number 8. Family support equals patient support. When the family is supported, the patient is supported. Number 9. Respect for siblings. Siblings and parents are affected by a family member's illness. Their needs deserve full attention too. Number 10. Parents support each other. Parents have a unique capacity to help other parents with support, information, and the wisdom of experience.
Well, there's some great principles there, but did you notice that statement that they made right at the beginning? They said eating disorders are biologically based mental illnesses and are fully treatable with a combination of nutritional, medical, and therapeutic supports. And of course, note the strong emphasis on family. Now, just quickly, it's interesting to see the contrast in our approach to anorexia versus our approach to another disorder, gender identity disorder. You know, it used to be considered that a claim by a child that it was not a member of the sex denoted by its genitals indicated that the child was probably suffering from gender identity disorder, not dissimilar from anorexia nervosa, in which sufferers believe that they're overweight. But advocates of the transgender ideology have been able to convince opposition and various medical groups of their belief that there's no such thing as fixed gender identity, and therefore the claim to have been born in the wrong body did not denote a psychological disorder. And illness, if at all associated with this concept, was actually only due to the distress caused by failure of society to affirm a person's gender identity or choosing their own gender. Now, I discussed this with Professor in Pediatrics from Australia, Dr. John Whitehall, on a previous edition of Family Matters, and I asked him, why are the two conditions treated differently, anorexia nervosa and gender identity disorder, when they're both very similar disorders where the mind is thinking different to the physical reality? Listen carefully as he explains both the push for transgender and the push for euthanasia. They are linked by the same ideology.
Well, I think they are, and that's what, when you argue the child knows best and we should let them declare they're a boy or a girl, we don't do that. I agree, we don't do that with anorexia nervosa. We don't give them time to explore their starvation because the kids will die. But what's the difference? The difference, somehow this ideology, this religion of gender fluidity has come out of the woodwork somehow or other. That this gives a new interpretation to human behavior, a new expectation for a new definition of sin. In a way, sin is not going ahead with the affirmation. A new definition of salvation. In the Victorian law, where does salvation lie? That lies in the embracing of your sexual problem. I can only understand this as the very successful almost victory, and sometimes I think it seems like a victory, very successful onslaught by a new ideology stroke religion. And it just shows you how people are susceptible to that kind of siren call. Come with us and happiness is here. Come with us and the explanation of human nature is here. And this is going to make a better world. It's a utopian ideology in that sense. So that's the only way I can understand the difference between the way we treat anorexia nervosa and the other, what we used to call body identity disorder, or that is to say, gender dysphoria. Well, I think they are, and that's what...
Oops, so we've seen that. Yeah, so, I mean, did you hear that wording? The onslaught of the new religion of happiness and utopia, a better world. So look, this has been a slightly longer episode, but just in conclusion, people struggling with body image issues don't need euthanasia. And they definitely don't deserve liposuction or weight loss pills. They need exactly what those with gender identity disorder need. Not a cutting of the body, but a healing of the mind. Let's continue to fight for the right for them to have that.